Could you be giving Tylenol or Motrin incorrectly to your child when they're sick with fever or pain? In this video, I'm gonna break down common mistakes I've seen as an emergency room doctor that parents have made at home when trying to give their child Tylenol or Motrin for fever. Hi, welcome to my channel. My name is Eli Fryman, and I am a board-certified pediatric emergency medicine specialist, meaning that I'm a doctor who takes care of children in emergency rooms. I work clinically seeing over 3,000 children a year in a local emergency department, and in this channel, I'm going to talk about my experience and expertise taking care of children in emergency rooms and how we can help parents take better care of their children both in the emergency room and at home. So in this first video, I'm going to talk about the mistakes that I see every day parents make when they're giving their children Tylenol and Motrin when they come into the emergency room for fever. Despite these medicines being so common, I see so many mistakes when giving these medicines to children, and frankly, avoidable emergency room visits that didn't need to happen at all if parents had a little bit more education and understanding about how these medicines could be used optimally at home. First off, let's talk a little bit about Tylenol and Motrin, what they actually are and what they actually do. Tylenol is the brand name for a generic drug called acetaminophen, and Motrin is a brand name for a generic drug called ibuprofen. Motrin is generally marketed towards children in this country, the United States, and you might be more familiar with the pill form or tablet form that is typically marketed to adults called Advil. We know that Tylenol and Motrin work by blocking a pro-inflammatory pathway in the body called the cyclooxygenase pathway. And cyclooxygenase leads to the development of a group of molecules called prostaglandins. And we know that prostaglandins are pro-inflammatory. That means they increase pain, they increase swelling, and they can lead to fever generation in the body. So what these two medicines do is they block the pathway that help produce the prostaglandins, and they can bring down pain, bring down fever, and help children feel better when they're sick. The first mistake that I see all of the time is that parents just aren't giving enough of this medicine. On the bottle, when you open the box, it gives you an idea based off of your child's age and weight, how much medicine you can give in order to help reduce pain or fever. The problem is that if your child's under 2, it doesn't give you a dosing range. And if your child's over 2, it gives you a very broad estimate. But the issue is that children do not come in the same shape or size. And realistically, we base medicine, whether you're giving Tylenol or Motrin, antibiotics, IV fluids, or really anything else, off of a child's age and weight. So 2 5-year-old children might need to receive a very different amount of Tylenol or Motrin when they have pain or fever. And every day I see parents who bring their children into the emergency room with high fevers, 102, 103, 104 degrees Fahrenheit. And the issue is that they just haven't given enough medicine. The first reason I see that is because children grow over time. And the amount of medicine that these parents have been giving when their children were babies or infants, they just haven't changed it. The child's now 2, 3, 4 years older, 20, 30, 40 pounds heavier, and yet the parents are still giving the same amount of Tylenol and Motrin to try to reduce fever than they did at home. As kids grow over time, it's so important to understand that they need more of this medicine to help control fever or discomfort. No matter what it says on the bottle, you'll see at the bottom, consult your doctor, talk to a physician if you have any questions about the dosing. And that's exactly what parents should do. They should call their pediatrician and say, hey, the bottle says that my 5-year-old should receive this much medicine, but she's this tall, she weighs this much. Should I give more than that? Should I give less? What's the appropriate dose? The second most common mistake that I see parents make when they're trying to control their child's fever at home with Tylenol or Motrin is that it's exactly that. They use Tylenol or Motrin. Realistically, these medicines are excellent when given together. In fact, if you give Tylenol and Motrin together or alternating, which I'll talk about in a minute, you'll find that you actually have better and a longer duration of fever control. Your child will be more comfortable, they'll be more playful, they'll be more willing to eat or drink and stay hydrated. And it's one of the things that I always recommend when children come into the emergency room with high fevers. One of the reasons we know that this is safe is because Tylenol is actually metabolized by the liver, while ibuprofen or Motrin is metabolized by the kidneys. So it makes biochemical sense that you're not going to overload the body with too much medicine if you give Tylenol and Motrin together. I often will see parents say, well, I gave Tylenol at home, so I didn't want to give my child Motrin, also known as ibuprofen, the generic name. because I was worried that that was too much medicine. And yet they find when they come into the emergency room and we give their child Tylenol followed by Motrin, that 104 fever that they couldn't control during the day, boom, all of a sudden drops all the way back down to a regular level. The child seems better, they sit up, they're playful, they're smiling, they're drinking water, and all of a sudden the parents say, oh, I guess we're good to go home. So I always tell parents these medicines not only are safe to be given together, but it's recommended to be giving them together. And as I'm going to talk about next, it's even better if you alternate them on a schedule. The third mistake that I see parents make so frequently when they're bringing their child into the emergency room for fever or other kinds of pain is that they haven't been giving these pain and fever reducing medicines on a schedule. Now, we all know that when you're sick and you've taken some Tylenol or you've taken some ibuprofen, Motrin, or Advil, right as that medicine's about to wear off, you start feeling pretty crummy again, even before you're ready to take another dose. Well, it turns out that if you're not giving these medicines on a schedule, it never really builds up into the blood to a consistent enough level over time to knock that fever down and keep it away. Parents are only giving Tylenol or Motrin once a day or once every 12 hours. Not only is it less effective, but you get a shorter duration of fever control. It's just not a good way to control your child's fever. Wouldn't you know it, there's actually a way to avoid that. You can actually interweave the dosing schedules together to make sure that a child is always getting some kind of medicine active in their system to help reduce pain or fever. So if you want to have better fever control at home, one of the best things that parents can do is to come up with a schedule for giving Tylenol or Motrin and make sure that you're following that schedule to be giving it every number of hours in order to make sure that the fever stays controlled. It provides optimal fever and pain coverage. And this is ideal because one of the things I worry about most when children are sick is dehydration. Parents are well aware that when their children are sick, they don't want to eat anything. They don't want to drink anything. And of course, not drinking anything for long periods of time could lead to trouble. Children get dehydrated, and all of a sudden you worry that you're going to be in even more trouble than you were in before. Well, if a child's not feeling well, we know that they're not going to want to drink anything. So if you don't give Tylenol or Motrin or other pain or fever reducing medicines on a schedule, you might enter that period where your child feels too sick to take Tylenol or Motrin. And then we enter the spiral. They're not feeling well. They don't want to drink anything. They don't want to take any medicine, so they feel even worse. So they don't want to drink anything, and they don't want to take anything, and they feel even worse. And then they spiral down and down. The fever goes up, their pain gets worse, and you end up in the emergency room because at that point, it got too hard to help control their symptoms at home. Now, the fourth and last mistake I'm going to talk about in this video that I see all the time that parents make when they bring their child into the emergency room is a lack of understanding of the best way to administer these medicines to a child when they're feeling sick. Parents with young children, like babies or toddlers or even school-aged children, often find it very difficult to actually give these children medicine. Whether it's Tylenol, Motrin, antibiotics, or anything else, it's a really common thing that I hear in my emergency room when parents bring their children in and they say they won't take the medicine. They're really hard to give this medicine to. They spit it out. They clamp their mouth down. They just won't take it. And oftentimes what I find is that parents are not really approaching giving the medicine to these children in the right way. Here are some tips and tricks I've learned as an emergency doctor taking care of children about ways to make it a little bit easier to get a child to take medicine when they're feeling sick. My first and favorite is actually to drop the medicine in a syringe and just stick it in the back of their cheek. Giving a young child medicine in a medicine cup and asking them to drink it isn't going to work if they're feeling sick or feverish, especially if their throat hurts or if their belly's hurting. So instead, if you pull up the medicine in a syringe and don't put it right at the front of their mouth at their teeth, which I often see parents doing, really put it further back into the back of their cheek by their molars and little by little push it in, not all 5 or 10 or 15 milliliters or cc's at a time, but just little by little. Patients often do way better taking medicine that way than trying to shove 5 mLs of Tylenol at a time right into the middle of their mouth. You have to consider what your other options. It's true that especially in babies, they don't want to take Tylenol, or if they're old enough, Motrin. Don't forget that there are other ways to do that. If your child is having a hard time taking Tylenol, especially when they're feverish or not feeling well, don't forget that Tylenol suppositories also exist, particularly especially for babies, and can be prescribed by pediatricians and sometimes bought over the counter in order to help reduce pain or fever. If your child really doesn't want to take anything by mouth, that is an option, and parents should talk to their pediatrician about considering. And lastly, don't forget that medicine, it all goes to the same place. When children take Tylenol or Motrin by mouth, it goes to their stomach, which means that if it would be easier to mix it with something to help your child take it easier, that is perfectly valid. Chewable Tylenol or Motrin in young children can be crushed up and put on ice cream or applesauce. I personally have put Tylenol in my kids' milk or formula when they were little in order to help them take it when they weren't feeling well or feverish. One of my favorite tips is actually putting a little bit of medicine into a spoon and then covering the bottom of the spoon with Hershey's chocolate sauce in order to trick your child into thinking that they're actually getting a spoonful of chocolate with just a little bit of medicine mixed in. But you see, there are so many different ways you can help encourage your child to take medicine when they're not feeling well, even if it's not quite as simple as just giving it to them in a cup. I hope this video was helpful. If you have ideas or other things that you'd like me to talk about, please put it in the comments below. It was a pleasure talking with you guys today, and I'll see you next week when I post my next video. Have a great day.